I think we have some questions already on board, and I will help address it to Tan Sri. So the first question, good morning, Tan Sri. Just want to ask, okay, whether online, because now we talk about all this digital usage, technology, whether online doctor-patient consultation is valid and ethical, as certain decisions need to be reached after a physical examination on the patient itself.
Yeah, limited, yeah. If you're going to make a diagnosis, there are some diagnoses, you look at the patient, you can make the diagnosis, yeah. But when you really have to do a physical examination, then you cannot. You have to go through the rigmarole, and then also you have to do your investigations. You have to go through the whole lot about doing, taking a history, which you can do online, of course, doing a physical examination and doing the investigations, yeah, and coming to a provisional diagnosis. You need to do that. But sometimes consultation is to give advice. Sometimes it's about counseling. So there are things that you can do online, yeah. And I think it's valid because online. I mean, it's not just phone, I mean, it should be face to face like we're doing now, through video, because you really need to see the expression, like as though the patient is in front of you. Just voice alone, I think it's not complete to me. It's not complete. You can also have voice. That's why people do telephone counseling, for example. Yeah, but it's not as good as seeing the person, because you get a lot of cues from even the body language, facial expression, body language. Patient walks into your room, you already know, from history, just by looking about 50%, they even have not opened their mouth. So research has shown this, so I think it's very important to be able to see and hear. Touch, you can't do online, yeah, but touch is also very important when you do your physical examination, yeah, and of course the other senses, smell and so on, yeah.
Yeah, okay. I mean, maybe just to extend a bit on the question, because what Tan Sri said is correct, because we are now talking about teleconsultation. But I think what Tan Sri mentioned is important, is the context of what is being consulted during that online platform, because there are certain clinical cues that very well. Even our exams, we had to modify, but certain aspects of the exams we still have to do some clinical component. So likewise here, when you're talking about an online platform, and just to touch a bit, maybe you have to make sure that sometimes, maybe not so much here yet, but in the West, I know whether some of those consultations are covered by insurance. I have read in the article where some consultations may not be covered by the insurance company. So I think in the United States, that's pretty big now. So, okay.
Yeah, there are legal, financial, legal issues to be addressed. But, technology is moving fast, the sense of touch, because we don't have, it can be transmitted through robotics, for example. I think it will come soon, that the robot is doing and you can feel it, yeah. So I think things like this are happening in artificial intelligence. It will come one day, I am very sure. If not, how you're going to go to other planets, outer space, if the technology doesn't develop?
That's true. So to quote what Tan Sri mentioned, I think we have to be innovative and always embrace changes. So maybe not now, but like Tan Sri said, the time will come when there may be things that that we never thought would be there anyway. Yeah? So Tan Sri, there are a few more questions here that I have picked up. Tan Sri, how important is mentoring during postgraduate study and during specialist time?
Mentoring, there are two things. One is coaching, mentoring, a lot of it is through the observation, of the person. You become a mentor, and that mentor is willing to sit down and hold your hand and teach you, yeah. So sometimes mentoring is from afar, you know. You can observe from afar. And you can also say that person is a mentor through the deeds, through the behavior. Yeah, you learn about that person and you say, I want to be like that person. I want to be like what he or she is doing. I want to do it. And I think it's very important in postgrad because you are learning from other people, you know, you're learning skills, you're learning techniques, you're learning your shortcuts, you know, and only a very experienced mentor can help you through this process. I think mentoring is very important in postgrad specialist program. Very, very important. And that's why I feel mentors are very important. You need to emulate the good side of the mentors. If you happen to get a mentor who is, I don't even want to say the word, you are going to turn out like that person because that person becomes a mentor to you, you know. You cannot see anything else. So it's very important, no, this mentoring process. Not all are good, you know. I'm stirring my coffee.
No problem, Tan Sri. Kita santai saja ni. I mean, because Tan Sri mentioned about mentor and that question also addressed about mentor. I think a lot of our postgrads are given mentors. Like Tan Sri mentioned.
Oh, okay.
So sometimes, like Tan Sri said, yes, we can choose and emulate the mentors. But every now and then we are given mentors, and I think we have to also be able to draw the line, right? I mean, you know, the mentor give feedback about the students, but sometimes the students are worried to give feedback about the mentors, especially if it's a given mentor, and if Tan Sri mentioned, these are the not so good ones that you have been given one. So sometimes people may ask, well, what to do then? Do you yeah.
You know the seed and the soil. During COVID now I become gardener. So sometimes you put the seed in the soil, it grows, sometimes it doesn't grow. It's like the seed and the soil. Not everything will grow in the soil. Mentoring is like that, you know, that relationship. So especially if you're given a mentor, I don't know what is the luck, how many percent you will get a mentor that will suit you. You are going to grow in that soil, yeah. Sometimes you may not, sometimes, and if you are stuck with that mentor, you just learn from the mentor, whatever it is that then maybe there are reasons why you do not like the mentor, you know, but you may be learning things about that mentor that you may carry through your life. You know, it can be very bitter experiences as well. So I think it's very important about choice of mentor. I think the mentee must have a say, you know, in the choice of the mentor. Maybe you need to develop some kind of matching, you know, matching characteristic. Mentee macam ni, mentor macam ni. See whether they fit, you know. Because some mentee, they might want some cruel-like mentor, you know. But some mentees, they don't want. So they're different, you know. What I like may not be what you like. But it's same soil. You have 3 mentees, for example. 2 may take to you. 2 may be okay, 1 not, you know. So so there are some matching characteristics also between mentor and mentee, you know, whether they take or not. Yeah. So I think good project to work on, you know.
Well, we do have in the university at present the mentor system where we also give additional training lah for the mentors. So we hope that they will embrace and become good mentors lah, as what Tan Sri mentioned. Yeah.
Yeah, but you know, personal characteristics ni susah lah sikit. Dah set in, you know.
Yeah, it's ingrained already, Tan Sri.
Yeah, after the age of 20, 21, very difficult lah.
Okay, Tan Sri, there's a question here. How would we approach new inventions or new treatments when the practice in KKM is service-based and the practice is widely based on clinical practice guidelines, and very new line of treatments and managements are usually brushed aside?
Correct. When you have a very hierarchical organization, very centralized decision making, innovation is not going to happen. And in the long run, it's not good for that organization, because you're not allowing innovations down the line, people to innovate and tell you, oh, this works, that works. Yeah. So in the long run, I hope with the new minister, there will be some changes. I hope, because he's a smart minister. If we put in some ideas to him, I think he will look at it. That there need to be ways of making an institution an innovative institution, an institution that will keep on changing with the time, will be open to new ideas. You know, I like SOPs, but SOPs can kill you, you know. So SOPs need to be adjusted. You know, you can have one SOP, but they need to be adapted to the local condition. You cannot have one central SOP and expect the district and the health center to follow. Cannot. And even health center or district, a district in Johor is different from a district in Perlis or in Sabah. They are different. You cannot have just one standard SOP and allow people to follow. Yeah. So I think this is what's happening. I hear a lot, you know, even in the treatment of COVID, you know, people are not allowed to experiment even, you know, doctors are breaking the rules, you know, this is very bad. And it may be good for the patient for all you know, what they're doing, but they're not allowed to do. In fact, they're being told we will take action against you. No, this is very bad. This is poor leadership. If you ask me, I said it outright.
It's okay. Right. Thank you, Tan Sri. Think there is a question here. Tan Sri, well, we take note that a lot of our postgraduates, well, for medical student, postgraduate, I think the ratio we see now a lot of females. So, well, this question may not be only females, but Tan Sri, how did you manage sexual harassment during your time as Vice Chancellor?
Yes. First, I did the code. You know, there was a sexual harassment code done by the Ministry of Labour. We took it and we modified it for the university use. Yeah, and we took action because harassment, as you know, there's a lot of harassment. If you go to OT, there's a lot of harassment. You know, there's a lot of harassment between senior doctors and junior doctors and nurses. You know, because one feel more powerful than the other. That's why it happens. Yeah, between lecturer and student, undergrad, postgrad. You know, because the lecturer has the power to pass or fail you. So they can have sexual, they can be, but of course, sexual harassment, there's a difficulty in proving sometimes, yeah. And of course, we have to balance because some so-called victims can also be playing the system, yeah. So I introduced a sexual harassment code in the university, and we even brought cases, and we formed a committee where it can be complained. Yeah, the complaints can come to the committee, look at it, and then go through the process of investigation and come up to the I don't know whether it's integrity. I think it's a sexual harassment. There's a committee, you know, forgot the name of the committee. It'll come up to that level, you know, to deal with the sexual harassment. There was a case, the lecturer just letak jawatan and went off, you know, but to me that's punishment already. But that's not, it may not stop him from doing it again in another place. Yeah. So I hope it's still going on, because I was very strong about this because I know it's going on. Yeah. Some people, so you know, some openly, before this came about, talking about sexual harassment as behavior that's not acceptable, people were talking openly like it's a joke, like it's accepted, you know, to harass a female student, for example, or harass a nurse in theater, you know, even verbally, you know, you don't have to touch, you know, using words, that's also harassment. Yeah, that's also harassment. I hope the one who's asking is not sexually harassed. You should go to your, go to Prof Zarina.
Yes, I think we are always there. I mean, if there's anybody, you must. Sometimes you can approach any one of us. Actually, who you feel most comfortable about approaching. To be honest, and we are always here. To be honest, Prof Nolaila, myself, whoever. Yeah. So I think that's something that we really need to be careful and address it, right? So because there's always an issue about abuse of power, right? So, Tan Sri, there is a comment here from the chat actually, or a question. I would like to ask your comment on colleagues or doctor who like to blame on other doctors' management of patient, as if they are good on managing such cases. Sometimes they like to make themselves look like the all-time hero. So, Tan Sri, your comment?
This happens all the time, right?
Yeah.
This happens all the time. So the person who is doing this feels he has greater authority, power over the other side. Yeah. So there's always a power relations, when these things happen. It's not, he feel he or she can do it. And so you need to break this relationship and show you can do the other way around too. You can show what they are doing wrong, but tit for tat for me is always no good. Yeah, but you can always rise up and challenge back. Don't let this. You have to be brave. If you are in the right, you're doing right, and they're just finding mistakes, then I think you should stand up. But if truly you have made a mistake, then admit it and improve yourself, because sometimes you may feel people are picking on you, but you're actually making the mistake, right? So you have to study that situation. Think first, don't react immediately. I always say, give a few seconds before you react. Stand for a couple of seconds to think, and then only you give your reaction. Just that interval alone will make you respond in a better way. Yeah. Of course, some people straight go into a fist fight. That one is the most violent. Yeah. Next is the verbal onslaught. Yeah. But if you stand back, think a bit, there may be some truth in what the person is saying, but if it's habitual, they, like we say, oh, saja-saja, they memang suka buat macam itu. No, actually, professionally, I don't think this happens, that you purposely want to go and find faults. I doubt very much, I think it's more like maybe there is, but it so happened that maybe the person is picking on you. You need to go right to the bottom and find out what is the real issue. Why is this person doing this to me? And try to sort out the issue. It might not be about your performance as a doctor, and it might affect you because it's your performance as a doctor, which is not the real issue, but it might be something else. It might be something else between the two of you that has not been sorted out. Yeah. So I think sort out that one. If not, it's going to affect your performance. Hey, he might be quietly in love with you or something. I don't know.
Yeah, so what Tan Sri is saying, in such circumstances, that means step back and reflect briefly.
Yes, reflect. Reflect
yeah.
and try to sort out the issue. No, I don't think that person is that so unopen. Maybe that person also cannot express himself or herself, what's the frustration and anger in them. So it's good to have a good chat, sit down and have a chat if you can. Resolve this power issue,
That's right.
People will keep on doing it. They think they can bully you,
Yes. So provided when you've reflected and there's no other new issues, and there's really maybe that person truly at the end of the day is that person being that person, the hero, then macam Tan Sri mentioned lah, yeah, that means be brave lah. Kan?
You can, you're brave, you give it back to him, or you can bring it up, you may be in different units or whatever, you can bring it up in another channel, in the channel you are familiar with, maybe you can handle, but someone else can handle this. Zarina, you're mute.
Sorry, Tan Sri. Okay. Well, this is a comment, but I want to share. I'm sure there are many more who have these comments. Thank you, Tan Sri, for your talk. Very inspiring during this trying time. So I just like to put that up. Okay, and betul. Yes, Tan Sri is always inspiring. Yeah, we always learn a lot from her every time we meet her. Yeah. So
No, you
question.
all inspire me.
Okay, no, Tan Sri, you always inspire us. You always have lots of things that we want to jot down, and So I'm so glad that this is recorded here, so that we can refer to it.
So on the 11th, I don't have to do, right?
No, Tan Sri, tak ada. Not this 11th. In future, inshallah. Yeah. So there's another question here. Salam, Prof. I really enjoyed your talk. It's really eye-opening. We have talked about sexual harassment. What about body shaming by superiors or consultants? What is your say about this?
Same, that's also harassment, they like to say, oh, you're a bit too much fat here or too thin or whatever, So body shaming is also a harassment, it happens in the schools too, not just in the university, and it's very shameful when it happens at this level, and you should stand up for yourself. I think you're old enough to stand up and give it back. You can go to the internet and see the ways you can respond to this body shaming, you can get a lot of good ideas. Go and say it back. You think the guy or the person who's shaming you, you think he's perfect? No way. So I think you can find something, but I don't think you should go tit-tat. You should try to make it funny, or you can twist it in another way. But there are many ways you can go and read up on it. But I think body shaming is one way, and when it happens to very young girls, it can mar them, for life. Yeah. So we have to be very careful. When it happens at our age, body shaming. Of course, as you grow old, you put on fat here and there, kan? Or after you had a few kids, you also put on fat here and there. But you think the men don't? Well, body shaming may not just be done by men, okay? But I think they are the major culprits.
Yeah.
You can also body shame boys, it happens both ways, and it's so unpleasant.
Yes, that's right. I think body shaming happens to boys, men, but probably more to women at present. But yes, we do have that. And I think actually, Tan Sri, when somebody does that, it is truly a reflection of that person, isn't it? The character, right? I think that's not on. Yeah? So Tan Sri, there's a question.
I think you all should get together and look at harassment, look at all these issues. Yeah. Even calling names. You remember that girl, Ain?
Yes, Ain Hasniza,
Yes.
the 16.
Oh, she was the torments, she was really tormented. What they said to her online, open, everybody can read, to a young girl like that, But look at the response, look at the responses that she also got when these things happen. This is the way you should respond. Yeah, learn from that. I think go to her website or whatever, and and read.
Okay, Tan Sri, there's a question here.
By the way, we said that we were going to make schools safer, guidelines on safer schools.
Yes.
I think you should develop guidelines for safer classroom in the university, safer environment, safer OT, safer clinics, So how do you do this, And these are the issues you should bring up. These are the issues you should deal with. And maybe even a session with postgrad students on this. Get the correct people. I don't think I'm the right person. Get the psychologists, the psychiatrists to come in and talk about this. They can go into more detail. They can give you more examples. And I think you need this. I think I noticed that a lot of the questions are centering around this. And I think you do need, in your session for your PPD, something like this. And it should be addressed to both male and female, you know, because they can both be victims and both be the perpetrator, you know. So address this because it comes in your interpersonal punya development, you know. So next time have a session on dealing with harassment, dealing with intimidation, you know, all these power struggle issues. Hey, we haven't even talked about rape.
Yes.
Ah,
You're absolutely right, Tan Sri.
sexual molestation. Yeah.
I think we in the committee here will take up on your suggestion, inshallah, yeah, because we can see that quite a number of questions have evolved around this, and sometimes people, I can see the questions are coming up here, but that's probably just the tip
because
of the
they see
iceberg.
me as mother figure.
Ah,
That's why they're bringing it up. I know they're seeing it like that, you know.
and unfortunately, you know, it's probably the tip of the iceberg because some of them will probably say it out here, and we do know that there will be those who don't come forward. So I think it's probably need to
I
address
think
it.
it's like 1 in 10. I think it's like 1 in 10. One speak up, 10 not speaking up.
Oh,
But they have experienced. Yeah?
yes.
We got this figure when we were doing the sexual abuse in children, exploitation. So we looked at this. So we always multiply the figure by 10.
Right. So certainly, I think we will do that. Yeah, Prof Laila and team. Inshallah, we will look into this matter. Tan Sri, there's a question here. Tan Sri, you envision the future medicine would be more of home and IT based. What is your thought about primary care direction with the current COVID-19 endemic?
Yeah.
Yeah.
With primary care, they are out there, you know, they're out in the community, they're not in the institution. Yeah. And so they are closer to the people than, say, the hospitals. Already hospital, very quickly, hospitals said, don't come to hospitals. If you're sick, don't come to hospitals. Hospitals are cold. Hospital will tell you, don't come. Or you have cough and cold, whatever, don't come. Even when you have high blood pressure, don't come. So that's a hospital for you. But primary care, they're out there. You know, there's no way they can tell patients, don't come. So for me, if people want to come to you, it's social distancing for primary care. People will come and you must welcome. But you must practice the good social distancing, whatever, like clean your clinics after every patient. You know, all the SOPs you should follow. But I don't think primary care as such, people will stop going. Yeah. But what will happen is, I think primary care physicians will combine clinic-based, home-based, and IT-based. I think they will do this. So there will be some things that they will use IT and make sure patients can do it at home. Yeah. They can give a child has fever, cough, and cold, which looks like, if you put on video, could be just a common cold, you know, home remedy, isn't it? They don't have to bring. Yeah, we know this. We know, we've been doing this. We in fact discourage people to come to clinics when the child is like that. You know, they will resolve in a couple of days. Yeah, but you can see, yeah, the IT. So I think there will be a combination for the primary care doctors, and I think primary care will increase in importance with COVID. Primary care, hospital based, as you can see already, you are ENT surgeon, you go and manage COVID patients. Already haywire in the hospital, you know, you're being deployed from your practice to go and do something else, infectious diseases. But I think primary care as such will not. COVID for them is like help find and trace, yeah, and help with the isolation, yeah, and giving the support services, you know, like counseling, giving more information, helping with vaccination, you know. I think this will be, you know, COVID is going to be with us. And it's already endemic, I think. And so we are not going to change our lifestyle. We are not suddenly going to say no need to wear masks. Yeah, even though you get 90% vaccinated, we still, because COVID is the first. I tell you, we're going to get more. We will get more other infections. Already we're talking COVID variants, variant. At the end of the day, the variants is so much, it's not even like the original COVID. So this biological issue, no, this biological problem, health problem, which becomes pandemic, I think it's going to be our lifestyle. It's going to be we're going to be facing this. So I don't know, you are practicing ENT and all that, all get affected. Pediatric surgeons cannot operate, you're seeing only COVID, but there will come a time when you see COVID and others. Yeah. So it's very disturbing the way the health environment is changing. But for the primary care, they will continue to see the patients, I'm very sure. But it will have to be changing SOPs. You have to keep on changing with the times, but always the social distancing methods will have to stay. Biological agents will always, be infection. Yeah.
Think like what Tan Sri mentioned, yeah, I also agree that I think primary care will be even a lot more important. And in fact, everybody now, regardless whether you are specializing in ophthalmology, ENT, they are all also now coming down to be involved in managing COVID. For example, in HCTM,
Frontliner kan?
yeah, that's right.
Primary
That's
care
right.
frontliner lah.
That's
Frontliner lah,
right. So
primary
they are
care.
also the frontliners now, regardless which specialty you are.
To me, humbling experience. I like it.
Yes.
Because all very high flying, all these specialists, they don't see, they only come look at the ear or look at the throat or what. Sorry, the ENT specialist. I like these little holes. But this, and sometimes you forget the whole patient, I like that this COVID situation is making them all come down to look at people as human beings, whole human beings, It's a humbling experience for a lot of these specialists, I think.
Yeah. I think I also would like to take the opportunity to applaud those trainees, because I know there are many trainees here from various departments. They do come and help in the medical ward, looking at the COVID patients. So I think, we would never have thought that we would have to do this, but we have to be adaptable, flexible, and resilient, I think, in the way we approach our practice nowadays. Tan Sri, there is a question here. So Tan Sri, the faculty, because study we were talking about female trainees. Tan Sri, the faculty hardly promote female lecturers with leadership quality. And this, I think, is important because we know that a lot of trainees are females. Do you think our faculty should work towards a program to mentoring lecturers and female students from great women leaders of the university?
Firstly, there must be a pool. So if there's a pool, that means there are a lot of women lecturers, a lot of female trainees. Then there is a pool. That's a talent pool. Yeah. Sometimes you cannot promote because the pool is so small. But if the pool is big, then I think the problem is visibility. Visibility, number one, the women are not making themselves visible. Secondly, of course, is the cobweb in the minds of people who are involved with the promotion, of recruitment, of training, of giving more opportunities. They feel like gender stereotyping, that women are not suitable for this type of jobs. Yeah, that women should stay at home and become mothers and take care of the children and so on. This mindset is still prevalent. Is still prevalent amongst our society. When I say society, it means all of us. Yeah, even in the institution. So when they see the woman, they feel, oh, if the woman is not visible, and if the woman shies, is very shy, doesn't go forward, they interpret it as the woman is not willing, the woman doesn't want. Yeah, that's why it's very important for the woman to not internalize this belief that they are inferior, that they cannot do. That's number one. Yeah, so the woman must say, I can do. And to do that, you must come forward, you know, and articulate, be voice out, speak, make yourself be heard, be seen. Yeah, that's very important. And then you gain your confidence in yourself. As a VC, and I keep on telling this all the time, when I first became VC, there were not many women in leadership positions, you know, as deans, heads of department, heads of centers, whatever, you know, in the university. I did my analysis and I saw the figures. And I said, something is not right. And I saw a lot of women lecturers and female students, more than 70%. What happened? Even the student election, the boys are in the committee, not the girls. The girl, one girl gets in, she's in charge of hal ehwal wanita in the student punya committee, okay? So, not right. So then, I said, for every post, promotion post or leadership post, we are considering candidates, at least one must be a woman. If you give me 3 names, at least one. You give me 2, good. You give me 3, extremely good, okay? But at least one. So what happened? Then they are forced to go and look, right? They're there, you know, the women are there, but they're not visible. So now they go look, then the women become visible. Then they can give the names. Because they now go search, they look at the CV, they look at what the woman has been doing. Hey, suddenly the woman becomes visible because they are forced to give the name. So when the names come, and if she's the most qualified, you can offer. And then next step, what happens when we want to offer as dean, deputy dean, or whatever? The woman doesn't want to take. The woman herself said no. When I was VC, I call them up. I do this first round, about 5 or 6 of them. After that, tak berani already. They all take up the offer. I call them up and talk and ask them to express what is their fear. Usually they will give stories like that. Like, I don't think I can do it, you know. Then if you ask them, what is your problem in your department? You have problem about financing your research and all that? Then they start, oh yeah. Then I say, if I give you this position, aren't you in a position to have the power to allocate money? You have that power, right? Because you think it was unfair last time. Can you be fair now? You can do it, right? They start thinking, you know, I say, you can do it, right? I have faith in you. I have confidence in you. Why is it you're not having confidence in yourself? Really, they know they can do it, but they don't have confidence. Yeah. So you let them do it, and nobody resigned. When I was VC, the jobs I gave, they did, and they did so well. When I left, I had more than 33%. Some were 50%. You know, DVCs, 50%. 2 men, 2 women. I didn't have pro-chancellor.
Pro-Night Chancellor.
No, pro-chancellor.
Oh, okay.
All men. Chancellor men, pro-chancellors men. So I said, what? I said, if I remove one, somebody will be very upset. So I went to minister and asked for one more. I want one more pro-chancellor. And then I went to my chancellor, of course, very nice, Tunku Mukris. I said, I want one more, but I want a woman. And this is the one I want. Of course, like related to him, kan. But it's a woman. So that's how Tunku Intan became our pro-chancellor. I wanted to show at every level there will be. Of course, that's only quarter lah, 25%, tak sampai 30%, kan. But in all the other positions, yes. But you have to take affirmative actions like this, yeah. So I think that's why some of them say, hey, you are my mentor, because I forced them to take up some positions in the university, you know. But you have to do it, you know, you have to do it. I did it. And I hope the VCs continue with this, even though they are men, you know, they should be sensitive to the gender issues, you know. And get the best talent, because some of the best talents are among the women, but because the women are not coming forward or they're not very confident, and we lose these talents. and it's not good for the organization. It's not good. Yeah.
I think as Tan Sri mentioned, I think the women, a lot of us, we work. I'm not saying that the men don't do this, but I know that the women are truly, they are workers. So sometimes,
Yeah, the problem is you work, other people are taking your credit.
yes, that's right. So that means when you are given the opportunity to lead,
Take it.
yes,
Never refuse.
that's right.
Even though you feel, oh, it's still so difficult, take it.
Yes, yes,
Take it, because you can always ask for help.
that's right. That's
Yeah, you
right.
can always ask for help.
Yes,
But
there's
take
always,
it first.
that's
Don't
right.
refuse.
Yes, you can always ask for guidance, and it will be there. I'm sure. Yes, and then you have to believe, lah, as Sanchi mentioned, that you've been selected and picked. So do it.
Believe that you can do it.
That's right. That's right. So I think there's somebody here. Maybe I just acknowledge. Yeah. Thank you. Apa ni? Dr. Zainal. Zainal. Very good input by Professor Tan Sri on leadership. So Dr. Zainal here mentioned. Tan Sri also gave a lot of quotes here. Dr. Zainal shared about our beloved Prophet. Yeah. Where just to summarize it, basically ketahuilah ya, setiap kalian adalah pemimpin. Dan setiap kalian bertanggungjawab atas apa yang dipimpinnya. So I think that thank you Dr. Zainal for mentioning that. Yeah.
I got a lot of quotes from Quran, Hadith, and all that too.
Yes.
Yeah.
Yes.
Next time I'll add.
Yeah. Okay. So.
But I didn't want to appear. I didn't want to appear like one-sided. If I quote, I have to quote everyone. Yeah.
That's right. That's right. So I've also always looked at some of the people that you have mentioned in the past, like Ralph Waldo Emerson. Yeah, I've always looked at that, and Maya Angelou. So I'm also always looking at what they have written. And very inspiring. Yeah. Jadi saya rasa memang tak ada soalan lagi buat masa sekarang. It's about 10 more minutes to 1. So mungkin saya will summarize lah ya, Tan Sri. I will just summarize a few of the points.
By the way, I can see the chat now. They want to do the guidelines. That's good.
Yes,
Very
we're gonna take up on what Tan Sri mentioned. Yeah, certainly. Right. So Tan Sri talked about looking forward. To do that, to move forward as a leader, you have to look back, meaning reflect, right? And have the vision, and you become the change that we want to see. It starts with you, basically. Yeah? And when you look around, that means you must address the needs of the society, right? And when you look inwards, to quote Maya Angelou, is to know and to comprehend. Yeah. And I think when you look inwards, I think this is a quality that is shared by many women leaders. Yeah. Because we are very detail oriented, as Tan Sri mentioned, and we have very good. Macam puji sendiri pula. But I think this is true.
Betul.
We have women.
Relationship oriented. Yeah.
Yeah, so women have very good interpersonal skills, okay? And as a leader, now moving back in general, be ready to embrace changes in the healthcare practices, and you must be part of the innovation system, because now we're talking a lot about digitalization and home-based care. So you must participate and lead through innovation. Always ask yourself, why are you here? Why are we here? Right? And make sure that you are headed to the right outcome. So soon, many of our participants here will have their specialist degree in 1 to 2 years' time. Yeah? But remember, as Tan Sri mentioned, you have just started your journey. Okay, so continue to sharpen your inquiry skills and obtain the necessary credentials. Okay, so remember, we always talk about think out of the box. But in true sense, although ideas come out from the box, outside the box, the real transformation is within the box. So it has to start inwards. So that's what Tan Sri again mentioned about looking inwards, right? And learning, we are all here about lifelong learning. Learning is an important component of leadership, yeah? And you must have a good balance between the hard skills and the soft stroke human stroke social skills. Yeah? So integrity is very important, because integrity is all about doing the right thing even when no one is looking.
Yes.
Okay, and empathy. Empathy is also a very important human skill, right? And just going to sum up a bit more here. I think we have to talk about about collegiality, lead by example, the golden rule: treat others like you want others to treat. Okay,
You.
yes, that's right. And banyak tu Tan Sri. Tan Sri apa tu probably has a book already or could write a book on leadership. Uh, I just summarize one or two more points. Sandwich your criticisms, right? Learn to sandwich your criticisms.
With
And
praises, yeah.
yes. And when you make decision, make sure that everybody has said their piece. And before you are a leader, right? This is by Jack Welch. Before you are a leader, success is all about growing yourself. But once you become a leader, success is about growing others, to nurture others. And final advice that Tan Sri wrote down here: do not be afraid to explore new paths. In other words, be a trailblazer. All right, and enjoy the journey, because it is just starting, and it is a lifelong learning experience. So enjoy it. Smell the roses, basically, as you are going through their journey. So I think that's all on my part, unless Tan Sri has got one particular take-home message that Tan Sri wants to say before I
take-home message, no.
No.
You have said it well. All the best to you. Enjoy your journey. And be knowledgeable, be skillful, most of all, be human.
Yes. Thank you so much, Tan Sri. Thank you so much. We are so humbled that you are here with us today. And I'm sure all of us have learned so much from Tan Sri. Jadi, I thank Tan Sri on behalf of the organizing committee. And I will now hand it back over to Prof Azarina. Terima kasih.